Hi guys! So I'm doing my 31-week pregnancy update, which is a bit of a surprise for me because I was planning on skipping, well not skipping, but I was planning on combining it with my 32-week update next week. But I had a very uneventful, in a not good way, past week, and I thought I would talk about it. So from the title, you may understand that this has to do with tooth issues in pregnancy. Basically, last week on Friday, I spent the entire day in bed because I had a really, really bad toothache that was, in my mind, quite definitely attached to an infection because I had pain in this area of my gums, and it had traveled up into my ear, so I had an earache as well. My sinuses were completely clear, so I don't think it had gone into my sinuses, and I also had a sore lower jaw area. And from that, I also had a high fever. I was running a temperature of, well, when I tested my temperature, because I don't know why it didn't even occur to me to check my temperature, but when we checked my temperature, I was running at 38 point something in Celsius, which was, I think, about 101 something in Fahrenheit, which is supposedly a high enough temperature that it is considered to be a danger to the baby. And I was running a really, really high pulse. So my pulse, when I would test it at rest, when I would be laying in bed, was around 120 to 130 beats per minute, which is also considered to be a bit more dangerous for the baby, because when your pulse rate is really high, it means that less blood is going to the placenta and baby's not getting as much blood. Baby was actually moving that whole time, but it did kind of feel like the movements were not as strong as I was used to, but they were still frequent enough that I knew baby was okay, but I was definitely worried because, like, when you're pregnant, you worry. You worry about little things, like really not important things. So, you know, when you're in constant pain, I was literally all day Friday, all day Saturday. I had pain that never went away. It was just always, it was always there. It was constant. It wasn't the kind of toothache that comes and goes in waves. I think because I had the infection attached to it, it was just there. So I had an emergency dentist appointment on Saturday morning, and when I'd gone in, he basically, before I went in, I will say that I had done like looking around online, because obviously that's what everybody has the tendency to do, isn't it? Like, you look around online and try to figure things out on your own. And I did actually already suspect that I had a dead tooth, because it's not, yeah, that's not noticeable. You can't see anything. It's not noticeable, like it's not obviously noticeable, but because I had a tooth issue, I was like staring at my teeth in the mirror. I could see that one of my teeth seemed to be a little bit off in color. Like the shading is just like maybe like one shade, or not even a shade, I don't know, different from the other ones. And when I went to the dentist, basically he'd said that that tooth had appeared to had received some trauma in the past and died, because he couldn't find any cavity anywhere on it or in the neighboring teeth. So apparently that's what he thinks caused the infection. I have had this problem occur in the past, but it's been over a couple years since the last time. It's not over a couple years, it's probably been about a couple years since the last time it happened. And from the last time it happened, it'd been a long time since the time it had happened before, because this was an issue that I used to have maybe 5 or 6 years ago now. I don't really know. I'd have to think about it a little bit harder, but I used to have this problem. Well, I had it once. The first time it happened, it really freaked me out because my entire face swelled up. And I was living in another country at the time. And, you know, when you're not like with your family and you're just, you know, you're not in a situation where you're comfortable knowing like where to go and what to do and how to handle things. You know, that was like a hard experience for me because it's like I had no idea what was going on in my body. And I had basically just let it heal on its own over time. And then when I went back to the US, I'd had that problem quite a few more times, like within maybe a year or two, where it would just kind of come up every few months. And then I think once I started eating fruit is actually when it started to stop happening initially. And I think that was because I don't know, I kind of feel like a lot of the times when it's flared up in the past, it's been because I've been eating more fat. I don't think that the fat is the reason why it's come up. I think that's just had something to do with like how my immune system has reacted to things going on in my body, and that was just like a trigger that let it go off. So when I started eating fruit, and when I say when I started eating fruit, I mean like when I first started trying to eat 100% fruit, not fruit, like fruits and vegetables, but 100% raw, that problem had stopped occurring. And then I did have it again, but it would always be like from binging, it would come back. Binging on like not just cooked foods, but binging on fatty cooked foods, it would come back. And then when I finally started oil pulling was when it like really seemed to stop happening. So I definitely think oil pulling has helped a lot for my tooth health. Yeah, but at that point I had never even, I mean, you could say it's stupid, but you know, in the US, like I never had like dental insurance throughout this time period. Like I had dental insurance in the past before that had occurred, but in that time period I didn't have dental insurance because, you know, I was working in a family business, and then I was working in my own business, and then I was working again in a family business, and dental insurance is expensive in the US, so that's why I never had it taken care of that way. Plus, on top of that, I've always kind of like aired towards doing things naturally, which doesn't always make you smart, but that was how I dealt with it at the time. So anyway, the oil pulling, when I was oil pulling, I never would have any problems. So a couple years ago, when I had the issue come back again, it was when I had taken a break from oil pulling, because the thing about oil pulling is that you have a tendency, like you'll do it for a long stretch of time, and then after a while you might kind of feel like, is this doing anything for me? I don't know, like, or you just get lazy and you just kind of like fall off the habit. So I'd fallen off the habit. I'd just gone to a friend's for the weekend with my husband, and we were eating raw, but we were eating some high-fat gourmet-ish raw. And then I came home, and I think I was just about to start a banana island, and because I knew I was going to start a banana island, this is like mind tricks that you like play with yourself when you're trying to stay 100% raw. It's like, oh, well, I'm going to do banana island, and well, you know what, I already just ate all this gourmet high-fat raw stuff. Might as well have some, like, you know, vegan sausages cooked. You know, and I feel like I don't remember what else I ate, but I ate some like processed, like not good for you, high fat, vegan foods. And so that was a couple years ago. That's when that happened, that I had my flare up again. So coming back to now, you know, I was oil pulling when this occurred still, but you know, I think the trigger this time was just the fact that, you know, you're pregnant, baby's taking a lot of the minerals, which you know, I'm happy to give baby anything that it needs, but your immune system goes down. So I think that, you know, even though I'm eating cleaner and I haven't had a problem in a long time and I haven't changed anything in a long time, you know, it came up again. And, you know, what can I do? Like, once like, you can always think back on things and think, if I'd taken care of this before, would I be dealing with this now? But I didn't, so I can't really comment on that part of it, can I? So I was oil pulling when this happened. You know, I don't think I was like, you know, I wasn't binging on crazy high fat foods. You know, it just flared up anyway because I have a lower immune system. I mean, I don't know if it has anything to do with the minerals baby's taking from me or not, but it happened. And because of that, I'm taking antibiotics right now. I'm taking amoxicillin. I made that choice because with the constant pain and the stress and the, you know, I was running the high fever, I was running the high pulse, like these were all things that are considered like to be dangerous for the baby. Of course, the infection itself, like running through your bloodstream, like that would be a danger to the baby. Do I want to be taking antibiotics while I'm pregnant? Absolutely not. I haven't taken a single painkiller, even though I've had a lot of pain. I'm not in pain at the moment. My mouth doesn't feel completely right. It just feels a bit off, but there's no pain unless I like, you know, directly wanted to like poke the gum in the area that it's been hurting. But yeah, like I haven't taken any painkillers or anything. But I chose to take the antibiotics because for me, like, I can't mess around with this in this situation because, you know, I've got somebody else that I need to worry about. If you're familiar with medications, amoxicillin, the antibiotic that I'm taking, no, it is not vegan. It's in a gelatin capsule. You know, I wasn't given like options and stuff like here. The nice thing here is that you get free dental while you're pregnant and for the year after you have your baby. When I say here, I mean I'm in the UK. But yeah, I mean, I didn't know what other options there were because when I looked online before I'd even gone to the dentist, like amoxicillin was the one antibiotic that would come up that was safe for pregnancy. And I didn't want to, in my mind, waste my time experimenting with natural options when I was running a fever and a really high pulse. I honestly felt like the stress was affecting the baby because like it's almost nice saying this, but it wasn't nice feeling at the time. But like I would like not feel the baby move for a while and I would like get upset and I would like, you know, rub my stomach and like I'd just like kind of be like, baby, like, you know, let mommy know you're okay, please. And like it would just give me like a little punch, you know, like as if it was just saying like, I'm still okay, mom. But it was always, it just, you know, the kicks weren't as strong as they normally were. And it's really upsetting, especially when you've got so many hormones running through your body. And, you know, everything is like even more upsetting when you're pregnant than it would normally be. And just the thought that like my baby was being affected by like my stress levels and like, you know, my temperature and, you know, I just felt like I had to take amoxicillin. Like, I didn't know what else to do. I didn't want to mess around with other things and like wait and see if they would work because to me, I just needed to get this infection cleared up out of my body, and I'll deal with it after I have the baby. So I'm taking the amoxicillin. Yeah, and then basically once I'm done with the antibiotics, I think I take my last dose on this Friday, and then I'm going to immediately start taking probiotics, and I'll try to throw in some fermented foods. The problem is they're a bit harder to find and come across in England than they are in the US. I mean, if I was in the US, I would like get myself some vegan kimchi, I'd get myself some sauerkraut. I know you can make your own fermented foods, but in my experiences, when I've tried making my own fermented things, they haven't come out so good. So, yeah. I'll do my best to reestablish my gut flora before baby comes as well, because I do kind of wonder if that'll affect baby's health, not having like all of this different bacteria to, well, I don't know how it affects basically, because they say like one of the pros of a natural birth is that baby is exposed to your bacteria as it's being born. So, excuse me, you know, I don't know if, I mean, I would assume that is affected by the antibiotics because they just kill everything. So, you know, I'm going to work on reestablishing that, obviously for my own health as well, because not everything that I do is for baby, although, yeah, everything I do is for baby at this point, because that's just kind of where your head goes. But, yeah, it's just one of those things. It's kind of like, I feel like I'm sharing this just to kind of, I don't know, because I do have guilt attached to it, but at the same time, it's like, I don't know what else I could have done at this point. And then at the same time, it's like, I don't know, what would you guys have done? Like, maybe it's good for me to say, like, what would you guys do? Because if somebody has really good input, then, you know, I mean, I never know, like, something could flare up again before I have the baby. I don't think it's likely because I've got 9 weeks left to go. You know, it's not likely, but you just don't know. So if anybody has any advice, that would be nice, like just about anything extra I could do. I think especially just like regarding like reestablishing like a good bacterial environment. Yeah, I don't know. It's not the best week for me, but you know, I'm feeling better. Oh, so basically I'll say Friday was the day that I felt the worst, and that was the day that baby kind of wasn't moving. So that night, you know, like I'd called my midwife and I'd left a message, and then we called like the labor and delivery ward, just because I wasn't able to get in touch with the midwife because it was kind of like later when we called. You know, just because in that moment I was like, you know, I'm feeling baby move, but baby's like moving a little bit weaker than normal. And I'd said that, you know, I was that I was going to the dentist the next day. You know, and their only advice was like, take some paracetamol, which is, you know, painkiller, which I didn't want to do anyway. The paracetamol could have helped with bringing down the fever, which could have been nice, but then I don't know, like to me, like if you're running a fever, it's because that's your body fighting something, so I didn't know if that was really an actual good idea to bring the fever down. Although I also didn't want the fever because that could affect baby negatively. But then I didn't take the paracetamol anyway because in my experience in the past, whenever I've taken paracetamol, I mean all sorts, any type of painkiller, basically, by the time I get to like the second or third dose, I've always thrown up. So I didn't need to throw throwing up into the mix of all of these other negative feelings that I was going through at the time. So yeah, I feel like I've probably like skipped over things or missed things, or I don't know, or maybe I've actually said more than I even meant to say, just because my head kind of all over the place right now. Like I said, I'm not fully with it yet. My energy levels are slowly coming back up. I've been doing a lot of liquids for foods. Definitely haven't been eating as much as I'd like to be eating, but then at the same time, like I've had zero appetite. I still don't have an appetite. So I don't know if that's just my body's way of saying like, let me heal and work on this first, or if I should really just be eating anyway for the baby. So I've kind of been meeting in the middle grounds where I've been eating, you know, I have been eating, but it's definitely been less than what I usually eat. But like, I don't know which way to go. So I'm just like, let me just do it in the middle. Like I'll eat, but you know, I'm not eating as much as normal. I think that's all I have to say. I'll show you guys my bump. Otherwise, there wasn't much like that happened in the past week that would have made it different from the previous week. So I do think I'll probably still be able to do a 32-week update though, because I have my midwife's appointment next week. So, you know, just updates on anything that comes up in the midwife's appointment. Oh, I didn't finish saying that. You see, this is the thing. I'm like, my head's all over the place. So on Friday, we'd called, you know, the midwife, the labor and delivery ward, and they just said to take the paracetamol. And they said that I could call the community office of the midwives in the morning. So by Saturday morning, like even like overnight, the baby started kicking a lot more, because I took like a cool bath to help bring my temperature down, and I had my husband go out and get me grapefruit juice. I really wanted grapefruit juice. So I drank grapefruit juice, and I don't know, like between Friday and Saturday, like suddenly baby was like moving like normal and like really strong, and that just made me feel really good. So by the time Saturday morning came about, I didn't even feel worried or need to speak with the midwife anymore. So I didn't bother calling the midwife's community office. I felt happy enough just to go to the dentist and get my antibiotics. Yeah, so just, you know, I just wanted to clarify that like it did go from like baby was like, you know, sluggish for the day, but the next day baby was completely fine. And since then, like baby has been moving like crazy, like normal. You know, I was worried that with like taking the antibiotics that maybe it would affect the baby. I'm not saying that it's not affecting the baby. I have no idea, but I'm still feeling a lot of movements from the baby. Baby's all over the place. So that just, you know, that does make me feel better. That's it. I'll show you my bump and then I'll say goodbye. So this is my 31-week bump with the clothes on. Make sure I pull my pants up and then pull that belly band thing down. Bump from the side. And then the bear bump, which is the best part. Yeah, so baby's a little trooper. It's a very strong baby. Not even born yet, and I know it's a fighter. All right. That's all I have to say. Hopefully next week will be like a much happier, upbeat update. Bye guys, have a good day.